Okay, so the fourth part and final part of Chapter 13 on the peripheral nervous system just looks at some of the simple ways that our peripheral nervous system interacts with our central nervous system that we learned about before. So we're talking about reflex activity. And so in this case, these are, like we said, going to be very simple types of communication in and then some type of a response that is generated very quickly in response to a stimulus. So what we'll find is that there are a couple different types when we talk about reflexes, certainly a couple different types. The intrinsic ones are often the ones that we're talking about in this example, where we're again trying to maintain homeostasis, trying to maintain body position, things like that. And so those are the ones that we're going to spend time looking at, but there's also acquired reflexes, but those really come from practice, right? Practice makes perfect, like riding a bike, like playing piano, like that type of thing. And so those are ones that come through time that are built into, like we saw, some of our motor centers in the cerebrum, so aren't necessarily true reflexes like we would think about with these intrinsic ones instead. So remember that when we were talking about any type of response for getting information about our body or about the world around us and then getting it to the central nervous system and getting it out, we said that we had 5 different components to it, right? So we always have the receptor, which is doing the translation or transduction. We then have our sensory neuron, which is adding it into and sending it in, the afferent, to the central nervous system. We have the integration center, which is going to be the brain and the spinal cord making the decisions and processing it. We then have the motor neuron, and then what we call the effector, right? So the effector is going to produce the effect. So when we look here, we're showing it within the spinal cord, right? And so while this can be handled, this type of simple decision can be handled at the spinal cord level, in most cases we will send sensory information up to the brain so the brain knows what's going on, so it can kind of oversee it on a management level. And when you see these diagrams, what you're seeing is, right, so here's our sensory neuron coming in. We can see how it's a unipolar neuron. Remember, we often have that dorsal root ganglion that's housing those soma or cell bodies. And then we see it coming in, and often it will synapse with an interneuron. And then the interneuron, like we said, is going to be the simplest way to make the decision about it, of the integration center. And then the motor neuron, the efferent neuron, is going to be coming out. So notice where our different cell bodies are for these neurons, right? So for the sensory neurons, they're located in the ganglion, right? So we have the dorsal root coming in, we have the dorsal root ganglion that's swelling like we saw. Then the interneuron is totally enclosed within the central nervous system. The motor neuron, or efferent one, has the soma or cell body in the central nervous system, and then of course it goes out via the peripheral nervous system to arrive at the effector. So we've got to understand the relationships with these. And what we're seeing right here is a simple example of what's called a polysynaptic reflex. So poly means many, so we have more than one synapse, right? We have one right here, and we have one right here. There are the possibilities of monosynaptic reflexes, one synapse. So the sensory neuron, the afferent neuron, actually directly synapses with the motor neuron. So you can't get much simpler than that. So in this case, what we're looking at here are spinal reflexes that are coming to and from the body. And so there's a variety of different types. And so we'll go through some of the examples of things like stretch reflexes, flexor reflexes, as well as superficial reflexes. And so some of the stretch reflexes have to do with muscle stretch. So again, remember with the muscular system, we want to be able to control it with the somatic branch of the nervous system, but we also have this low level of tension that we maintain that's called muscle tone, where we have it partially contracted so it can contract more, it can contract less, or basically relax. It's got options both ways, and it keeps us in its ready state. And so when we're looking at these different muscles, if something happens, if we move or if something moves us, etc., we need to be able to be prepared for that, whether we're counteracting the shift or whether we're preparing that limb to do something or return it back to its initial state, etc. And so when we talked about receptors at the beginning, we were saying that there are different types of mechanoreceptors and proprioceptors that are, in this case, going to come into play. So we talk about two different types of monitoring of our skeletal muscles. So we have those that monitor the muscle itself and those that monitor the tension of the muscle as they are monitoring the tension that is put onto the tendon, which is connecting that muscle to the bone. So here we can see them when we talked about these as some of our encapsulated types of receptors, but we have the muscle spindle, which we see going around the muscle fibers, and then we have the tendon organ, which is down at the tendon as well. So the muscle spindle on the one hand is looking at muscle stretch. Now remember when we were talking about skeletal muscle, two types of contraction, right? Isometric, where the tension changes but the length doesn't, and then isotonic, where the length changes but the tension itself doesn't. So we have to know what's going on with the muscle and the muscle activity and the position of those joints, etc., at all times. And so with the muscle spindles, it's looking at muscle length or muscle stretch. And remember that for the nervous system, it's not, when we're talking about intensity, we don't send in bigger action potentials and smaller ones. It's all about frequency. Is the signal slow and regular, or is it more urgent? Are we sending in a lot? And so we see that if we have something like an unstretched or a relaxed muscle, we see the pace of that action potential being sent in is much slower than if the muscle gets stretched. Now we see it occurring much faster, right? And so the nervous system is going to perceive that as muscle stretch and then respond accordingly. So this is looking at the muscle stretch, but then there's also the tension on the tendon. So that way, even if the muscle isn't changing length, we know that we can generate force, and that's going to be pulling on the tendon, so we can get information even about that. All right, so these stretch reflexes are some of the most common ones that you may have experienced, including the knee-jerk reflex. And so what we find is that with a knee-jerk reflex, we have the 5 components, remember? So we're going to have, here's our muscle spindle. You can even have, remember, receptors, for instance, associated with the tendon, like the quadriceps tendon, etc. But what we're seeing here is that when the hammer, hopefully a medical hammer from the doctor, is hitting that patellar ligament, the patellar ligament is associated with the quadriceps tendon, right? It's all one piece of connective tissue. So when you hit that ligament, what it's doing is it is automatically stretching those quadriceps muscles. And so the brain and the nervous system is saying, hey, whoa, I didn't do that, right? What's going on there? Why is that stretching beyond where I had it positioned? And so automatic response is to try to put it back to where it was. And so when we look at it, we have the stretch receptors that go off. That relays the information to the sensory neuron. We see it coming in. There's that dorsal root ganglion like we were mentioning. And we see that it synapses in 2 ways. So you see there's a branch here that synapses, a monosynaptic reflex, that goes automatically with a motor response out to the quadriceps. And the quadriceps are going to contract. And as they contract, then the leg is going to kick out, right? Because they were stretched, and we're doing the opposite reaction of contracting them to shorten them again. So that's the monosynaptic reflex. But then you can see an associated polysynaptic reflex over here, where this is going to the hamstrings. Because with this, remember, these are antagonistic muscles. So if we're going to contract those on the anterior side and extend the leg, we have to make sure that the ones on the posterior side, the antagonistic muscles, are relaxed. And so that's the signal that we have going out to the hamstrings to make sure that those are not preventing us from going along and doing the response that we want. So we have an excitatory pathway, and then we have an inhibitory pathway that's going at the same time. Okay, so that was the stretch reflex based on the stretch of the muscle. We also have the tendon reflex. Again, in this case, what we're looking at is with the tendon reflex associated with the tendon organs down here, same type of thing we're seeing in terms of this pathway, right? So overall, the response is the same, but we want to make sure that we are not overstretching those tendons, right? We want to prevent damage. We don't want those nociceptors to go off, etc. So what we have here is when those quadriceps in this case are contracting and we're pulling on the tendon, what we have is there's a reflexive arc that goes in and comes out. And when we look at it, what we find is that in this case, we have an inhibitory reflexive response that goes to the quadriceps muscle and a stimulatory response that goes to the hamstrings here to kind of mediate and say, oh, let's slow this down a little bit. Let's not like kick it out where we can, hyperextend the knee joint or something like that. Let's have this be a little bit controlled. So we're going to use those hamstrings to kind of, like we said, kind of mediate and slow down the activity of the quadriceps on the anterior side. So again, subconscious level occurring. Even though it's a subconscious level, don't think that this is autonomic nervous system. It's still somatic nervous system, but it's being controlled down at the spinal level, right? Rather than the brain. Like we said, the brain is getting the information. There are relays that go up to the brain that relay and tell us what's going on, but the spinal cord is actually controlling it, issuing the commands. There's also some flexor reflexes that we see, and these are interesting because these ones occur like we were seeing one leg, and we were seeing it go in and come out to the same leg on the same side of the body. It's called ipsilateral. And so there's also what's called, in this case, contralateral information and control. So it's going to go to the other side. And so what we find here is that, again, maybe as you're walking or something happens on one side of the body, the other side has to counteract that action to make sure that we don't fall over or something. So the example that your book gives you is stepping on broken glass causes that first leg to come up like a nail, but when we do that, we want to make sure that the other leg is prepared to take all of that weight. So we've got to have activity going for both sides. Same side is where the stimulus came in, that's ipsilateral, and then contralateral connection and communication as well. So this is an example, another example of an extensor reflex in this case. So this one, somebody grabbing your arm causes that arm to flex and then the opposite arm pulls away. And so if we look at that, right, so we see somebody being grabbed right here, and so you automatically, right, those muscles start to stretch, so you reflexively contract them. And so as you're doing that, we look at this pathway where we can see, again, the same type of reflexive reaction occurring, but we also see, here's your cross communication right there, right through that gray commissure. It's going over and it's influencing the other arm on the other side of the body. So it gives us kind of a reciprocal, what's called activation. So those are ones that are involving some of the muscles and body position, etc. There are other ones that are called superficial reflexes, and these ones are more, again, associated, as the name indicates, with the skin or with the superficial levels of the body. And these are ways that, besides we were doing the knee reflex and checking, the innervation and the muscle activity, etc., these are kind of checking the pathways, the sensory pathways and the reflexive pathways. Remember we talked about dermatomes in different areas of the body. They're handled by different spinal nerves. So these are ways to make sure that those pathways in different parts of the body are operating. So one is called the plantar reflex. Remember, the plantar surface is the bottom of the foot. So this is checking some of the lumbar and sacral pathways. And so it's not a tickle, but a stroke along the plantar surface of the foot will naturally make it a downward flexion, a plantar flexion of the toes, right? So much like I'm doing like this, but with the foot. And so that's going to be a normal response. But if you see an abnormal response, then it would be going from this, and it would go, oh, it would kind of, the toes would splay out and go the opposite way, like a dorsiflexion instead. And so that can show damage. If you get the opposite response, that can show damage to that pathway or to the corticospinal tracts that control that pathway. But the other interesting response that you can see is called the Babinski's sign. In adults, that would indicate that there's some sort of issue, but in kids younger than a year, these neural pathways are just establishing, and then the neurons are actually finishing up being myelinated. And so when you're under a year, when you do this, the natural or normal response is to get the Babinski sign where you get the dorsiflexion, but then after a year, 2 years, etc., you do that same thing and you should get the plantar flexion, showing that these neural pathways are developing properly. Okay, So, as we were just finishing up, we were looking at some reflexes, some examples of the 5 components of how we get the sensory information in, how we process it, and then generate a motor response. So it gives us some examples of some of the simplest types of sensory information, integration, motor response, but it's the same type of thing that we were seeing throughout when we were talking about the central nervous system processing and doing its job in controlling and coordinating the body. So that finishes up with the peripheral nervous system. Our last topic that we address is going to be our special sense organs. So we'd already talked about those types of simpler receptors that translate or transduce a stimulus into something that our nervous system can understand, right, into electrochemical signals. Now we're going to talk about those organs, whole organs, right, that are dedicated to transducing or translating the world around us into something that our nervous system can understand.